Hello, we have a hamster here today that's going to be going into surgery for a mass removal. This is Lola. She's a 16-month-old hamster. And so at 16 months, she's a little bit of a senior. She is sedated right now, so you can see she's moving a little slower than her normal hyperspeed. But if you look under her chin, you'll see that there's a solid tissue mass under here. It is not connected to the cheek pouch, which is up here. It's pushing on it when I move it. But this is in the subcutaneous tissues under the neck. It is mobile, so we expect to be able to remove all of this mass at surgery. And then we have recommended doing histopathology to find out what the actual tumor or cells are. One thing that we can get, even this high up, is mammary tumors because they have tissue kind of going all the way up. And so that's always a concern in any rodent, much more common in rats than our hammies, though. But that's Lola. We'll keep you updated on how she does. She's a good little girl. All right, we're all done with surgery, and she's waking up and starting to be a little more busy, which we like to see. She is shaved pretty extensively, so you can see we have a mohawk now. I'm going to try to gently lift her little chin and see if she'll let you look. Not so much, but hold on, little bug. I know, those little handsies. So you can see the mass is actually gone now. And you can see some clumping there, which is just the sutures under the skin. What a good girl you are. She did great with surgery. And the histopathology is really the important point. Histopathology is sending the tissue into the lab, and it tells us what kind of tumor this is, if all of the tumor was removed, because visibly we can remove everything, but there can be cells going beyond the margins. So the histopath will tell us that. And the importance of knowing what kind of tumor is knowing if it's likely to spread or where it's likely to go. And so it can make a big difference in prognosis and future care. So I encourage owners to do the histopathology if they're able to. And now it's really just aftercare for her. As you can see, maybe, if you can see her neck, I actually put all the sutures under the skin. So there's no sutures on the outside for their little hands to try to take off. We do use tissue glue or tissue mend around the incision more as a distractor. I'd rather have her clean her neck, not the incision, and so we try to keep them busy with that. And she will go home on pain medications and just supportive, loving care, making sure she's eating, monitoring the incision, but we expect her to do well.